Hello, everyone. I'm Lynn Cremando for YogaUOnline, and I'm pleased to be here today with Dr. Suzanne Martin. Dr. Martin is a physical therapist, a gold-certified Pilates expert, and an award-winning author. She's a former dancer and visual artist with over 30 years of teaching experience. And some years back, she made a career transition from performer and dancer to movement specialist, working with other people in the field of human movement potential. She was a founder of Pilates Therapeutics, LLC, which is an educational organization for movement instructors and coaches and therapists. And her work has a strong focus on issues around spinal symmetry, specifically spinal scoliosis, which was in part inspired by her own body. So welcome, Suzanne. Now, this discovery of scoliosis in your own spine led you to look for something that would allow you to better organize your body and create more structural support and foundation. And when that took hold, you ended up being a movement professional, helping other people work around their spinal anomalies, shall we say. Can you walk us through that process for you of what it was like to find a way to organize the soft tissue around the structural issue of, in your own case, say, spinal scoliosis?
When I went into physical therapy, so I did an actual career change in the late 90s, and one of the first things that I got trained in manual therapy was fascial release. Mm-hmm. And so I went into more of these, what they call the soft techniques, and that tremendously woke everything up about just how much structural integrity that the body can have from that kind of organization. Mm-hmm. So in my whole spinal asymmetry mode, I try to bring in, when I'm teaching on that, to talk a lot about just how helping somebody to understand how to activate the fascial slings gives you way more strength and organization. And even if you have this super structural component where one thing's really out of position, you can still find a way to activate the functional parts that you can improve it. And that's why I believe it's a lifelong practice, is that it shifts around, just like anybody's body shifts around through our aging processes and just what happens in life, having children, the kind of job we do, all the repetitive motions. And so being able to access those, now we finally have an actual research to back it up, because when I first started out in this kind of thing, the orthopedic section was saying, oh, this is woo-woo, this is a bunch of hooey, this is odd stuff. And yet so many movement education practices are based upon that, really, that in neurology, right? So
can I stop you for a second, because you use this term spinal asymmetry. And I want to know if spinal asymmetry is the norm or the exception. And I want to know, what is spinal symmetry versus spinal asymmetry? Is there such a thing as symmetry in the body? My theory is no. So I want you to prove or disprove my theory.
Well, the thing is, it's amazing. As a matter of fact, I just had a client earlier, and he was an engineer and he works with orthopedics for about 9 years. And he said, and he went and he studied anatomy really heavily. And he said the biggest thing, and what I found out in studying anatomy too, is like what enormous amount of variation there was from individual to individual.
Right.
But the fact is when you look at it from the back, you should see what's called the central spinal vertical line. So that's normal. But the problem is that the internal body is asymmetric. So you have one heart, you got one heart, you got a big liver, that one kidney's higher than the other. The domes of the diaphragm are on level because of that relationship. And because of that, there's a slight twist that goes on all the time. And so everybody's got what they call a physiological amount of curvature, And part of it's because most of the world is right-handed. I mean, they've actually been able to do the research on this. It's amazing. I mean, the world. So we think that probably this right-handedness and this asymmetry in the domes and the organs, that anybody who has any sort of predisposition to having a twist start, then it will. Because when you're growing up, you know, whatever position you put the skeleton in, just like having braces on your teeth, it's gonna form in that position. But there's lots of reasons why.
About how that, I always say this, it's only a problem if it's a problem.
Yeah, it's true.
When is it a problem to be asymmetrical? When does a little bit of postural flim flam turn into a structural problem?
Well, the thing is that because it's considered physiologic, and so that's up to about what they call 10 degrees measured on an X-ray seen from the back, you know, anything curving out from that central spinal vertical line. And so, anything past that is considered actual scoliosis. But the thing is that it doesn't necessarily have to be a medical condition. So there's argument that it's really a body type, which can be true. And lots of times it's adults when they develop pain, that's usually when they seek help, or they think that it's a cosmetic fix. And, you know, that's not always possible. But the fact is that usually when it gets to, you know, so everybody's probably got close to 10 degrees just from this right-handedness and the asymmetry. And then once it starts to go past that and a person's in their growth spurt, that's when, you know, it can set in. And then usually it's not considered like severe until it gets to about 40 degrees, 45 degrees.
What would that
I even had
like?
somebody
come in with. See 40 degrees? Could you see it if I had it? Would I be able to see it?
You know, maybe not. So that's the thing, is that that the body can compensate around it, you know, and just with your meatiness. And so sometimes it's not apparent. As a matter of fact, I've had clients who, one woman was really mad because when she went to go get her DEXA, which is the, you know, the bone test, sort of a semi X-ray for looking at bone density. And actually the technician mentioned to her, it's like, oh my gosh, look at this scoliosis. And she was upset because she felt like, wait a minute, somebody can see this on my DEXA. And for years I've been getting DEXA scans and no one told me until now, because it wasn't until hers had flared up and she was starting to have pain from it that she understood that. And then she said also, you know, my husband never said anything to me. Like, people will go and have things tailored because one arm is longer than the other, or the pant legs are different. But, you know, the spouses don't always want to say anything to them because they think they're being kind. And then also I've had some people in some of the scoliosis trainings I've had, that the instructors that were training them about scoliosis tell them, don't tell somebody they have scoliosis. And so I think that's a disservice, but I think you have to be careful on how you say it to somebody, because frankly, it's not my scope of practice to diagnose. And, you know, if someone has, I hate to say it, it is a deformity at a certain point, right? And people can be very stable, believe it or not, with very high amounts of it, but it would behoove them really to develop some life practice around this, because it does increase with age, just because the spine degenerates. As a matter of fact, it was just on this international training this past weekend with the Scoliosis Research Society, and I'm part of SOSART, which is conservative care for scoliosis. And what this surgeon was saying is that in adults, really the big deal is don't over focus on like these big curves and trying to straighten them out, because it's their lumbar spine, the lowest lumbar spine, that degenerates, and that's getting the fallout from the curves above. So the more you can do, so I was like, whoa, that's good for us in movement education, because we have to not just see what we call in physical therapy, just the red herring, because it smells so much that you go to that big thing, but that's not really the problem. Because as we get older, the main deal is to walk for the rest of your life, right?
Yeah.
And so, yeah, so the lumbar spine and strengthening them through the waist. So, I mean, that's why I saw God. I mean,
Yeah.
I mean,
You're
I
saying,
have a daily practice.
you're saying core, inner core, what in the fitness world they call the stabilizing core, the muscles that actually touch the lumbar spine.
Yes, like,
Supporting
yeah,
those and strengthening those can be more effective than trying to straighten out a curve.
right. Because you may not succeed if it's already a skeletal deformity. I mean, there's parts of it that you can change, and then there's going to be parts that you can't change.
Now, how does the tie back into the fascia? Because that's kind of fascinating in the spiral thing that you talked.
Yeah.
Can you tie those together now?
Yeah. You see,
How does that
because
work?
we've got the skeleton, but then we've got all this connective tissue on top of us, right? And so one of the things we found out about the fascia is that it's like the great connector that we talk about these individual muscles. And when I was doing the fascial release training, he was like, don't mention muscles. I was like, oh, okay. And so what we do is really, we're trying to find the lines of pull. So if that, and this is the great thing about yoga, is that it really can give sustained tension, that's what's needed for affecting the fascial lines. And so you have this skeleton that may not be quite right. And then you have all of this connective tissue and musculature that's trying to bring a person into balance. But depending on how many things they do with repetitive motion, it will twist it. Just like if I sweep real hard down my driveway in one direction, well, I'm winding up all my musculature and all my fascial sheets to kind of go in that way, right? So this is why our daily practices are really helpful, is that we need to keep kind of whittling it off.
Yeah, I know that your background is kind of Pilates, but please do talk about yoga and how it sounds like this isn't a wait till you have a problem situation. This is a put this into your practice now, but what are we putting into our practice? And what can we do if it's too late?
Frankly, it's never too late. You never say that. We don't wait and see, we try and see. Okay. Is that so we want to be proactive. And frankly, I believe it takes a village. And that there's just certain things that happen in Pilates that yoga has. I mean that you can't get everything sometimes from one modality. Mm-hmm. And so that's why I love yoga so much, is that yoga touches the element for people with spinal asymmetry, people like myself, where it gives people more time for this inner learning. Mm-hmm. And that the cues are, and definitely Pilates uses cues that work, go over the fence and all of that sort of thing. But is that yoga then can give you this, reach and see how you're feeling to go internal. I went to the most amazing yoga class. We've had outdoor classes here, not, now it's getting colder, at the nature center, and they were awesome. And these ladies, I love them because they would start out their practice by reciting a poem. And then the thing that's good about it is that, it's calming you down. And then your breathing then is almost being like a pranayama. So that it's, going with an inhale and sort of a pause, an exhalation. And it's giving time for this to hook into the parasympathetic portion of our autonomic nervous system. So anybody, I don't know if you worked with somebody who has scoliosis, and when they're flared up, they think they're dying. I'm sorry, it happened to me too. And so now I know better, and I try to tell people, look, calm down. You have to figure out some way to calm yourself down. And so yoga gives the time to calm somebody down. Is that, of course, there's extremely rigorous ones, rigorous kind of practices of yoga, but in general, that it gives time to hook into the somatic component. Because I tell people that movement is like, I break it into like 3 types of modes, like somatic, corrective, and then conditioning. And so physical therapy tends to get stuck in corrective, and it's regional. So practices like yoga engage the entire body and then gives time for you to connect it into past your mind, because sometimes our imagery in Pilates, it gets stuck in just sort of the physical imagery of it. And so that's nice that we're all anatomists and everything, and that we can talk about what fascial lines are, but it does take extra attention and gives mindfulness. So somebody who has spinal asymmetry can get pretty freaked out. And then also just the culture of self-acceptance and non-judgmentalism, because you see, once you get into performance, it's bad. But I hate to say that, sorry everybody, is that it's true, is that things become competitive, which is external, instead of trying to just develop our best self. And so I work with high-level professionals actually, and frankly, for those people who are pre-professional and don't get that message, they self-eliminate really fast. So it's not about us or them, it's doing for yourself. So it almost doesn't matter.
If I could jump in, is this yoga can offer a modicum of mindful awareness, but there's also the breath component. If you're doing a breath-based practice and you're going with mindful awareness, then you are discovering, or you know how they say about sculpture isn't that you're making something, it's that you're releasing something that was already in the form waiting to come out. It sounds like what you're saying is in a yoga practice, you can develop the mindful awareness of where the body is and what the potential is for movement and for improving a condition. And you
Yes,
poses, I guess.
Yeah, right. I think it's super helpful. And in the, yes. And so there's so many, asanas that you guys use that, and we have a crossover in Pilates, because there was an article that came out in Yoga Journal right when I was getting, trained in Pilates, and that was, decades ago. And it was talking about Pilates being moving yoga. Well, it can be, and since 2000, in year 2000 in Pilates, that there was a class action suit filed where the term Pilates became generic. And so after that became really kind of the glut of training. Anybody could say that they were training you to do Pilates, and there's no really kind of, it's taken years. Now it's different. We've made like national and international organizations to try to rein everybody in so that, it's more qualitative like it was originally. And so, but yoga satisfies, tremendous amount of that, almost like the original Pilates was. And there's still, a number of us who want, that keep sending the message to the young people coming up that it's more than just exercise. And so yoga is definitely much more than just exercise. So this is why I like to use the term movement education, is that, movement education is something different than just giving, doing a fitness class.
So how important is it for me as a Joe, public, to understand my spine, to understand where I have asymmetries, and what would I be looking for? What are the signs?
Well, the signs are this.
Like a shoulder's higher. And
well, actually, it has to do, shoulder height has a lot to do with it. Actually, if I relax, you can see that my left shoulder's lower. And actually, I'm right-handed. So actually, my right shoulder should be lower if I'm right-handed. So that's something that was found out by a physical therapist who worked with polio, and she created some of the first manual muscle testing in the 1940s. So there really kind of wasn't any actual physical therapy before, like the world wars and like when polio and tuberculosis and war wounds happened. So it's the height of the shoulders. There's usually a winging shoulder. So one shoulder will stick out in the back more than the other. So that's a dead giveaway. We look at the heights of the hands. If somebody's standing up like at mountain pose, you look at that. And even when you're like in an upward salute and things, looking at the distance from here, from like the head to the upper arm. And then actually a dead giveaway is actually the negative space between the upper arm and the ribs, because then it shows you like a shift. Yeah. And so, yeah, so there's definite things, I call them the smile lines between the gluteus maximus, where it meets the actual hamstrings. And usually there's one that's not as developed as the other, because it's, because it's a rotary component to the pelvis. And then starting to develop, to look at the musculature in what I call the pelvic archway. So seeing that the inner legs, that the muscle tone's different from one side to the other. So sometimes those things are hidden because I'm a physical therapist. I can ask somebody to strip, but and I guess there's the people do wear their skivvies a lot in yoga, but but in general, we're looking at people. And so if you start to develop your eye with like the actual shadows on their clothes, and just the way that the wrinkles are being pulled, then you'll start to see it. And you'd be surprised, even somebody with a really big deformity, like a 50 degrees rib, I hate to call it a hump, but like a hump, but I call it the lateral prominence, to be kind about it. And you may not spot it right away. And also people kind of have the halo effect, is that when they're beautiful or they're young, like you won't see it as well. So, in performance, how to, if my legs aren't doing well, I'm selling it up here,
But tell me if I'm wrong, just because these aren't even, that doesn't necessarily mean a scoliosis. It could just
muscle
be
imbalance. So you see, so it starts with spinal asymmetry, and the skeleton tends to be held asymmetrical. And then the musculature tends to develop asymmetrically, or is just becomes in muscle imbalances. Too bad I don't have it here, but it's this amazing photograph that I show the dancers from this woman, Florence Kendall, who did this manual muscle test book. And it's manual muscle testing and posture with scoliosis. So that's like my Bible in so many ways. And then she shows this X-ray of somebody with really hyperextended knees, and how far off the central line it is. And she takes the same person and then just does muscle balancing around the calf and where the weight is on the sole, on the on the ankle, and it is completely lined up again. So so some of it's from this connective tissue musculature that's then perpetuating these twists. So that's why the things that we can change are these soft tissue elements a lot. And breathing is something that helps you to expand from the inside out. So you see, so especially in the breathing practices, I say that scoliosis is like a problem that the torso is imploding upon itself. So you see, so if I do this and you see somebody slumping a lot, and you can see that I'm like bending on this one side, and this side is imploding upon itself. So I do all of these things to try to breathe into that area, to actually work on these lateral lines. So this is a lateral fascial line, the spiral line coming from one side of my back up to my armpit. And as my arms are reaching up, that's different parts of my spiral line. It could be my lats, it could be my quadratus lumborum. There's so many things that are changing where the shoulder girdle is moving back and forth.
So you're going to be teaching a course for YogaU called The Myth of Symmetry, Finding Harmony in an Asymmetrical Spine. And it sounds like these spiral things and these fascial lines are going to be a big part of that. Is that right?
Yeah, it's what I was just talking about, is that I'm going to be going over really, I'm going to dive deep and then help people to see where it comes from, because it, lots of times people think, oh, we just all come out the same way. We're cookie cutter cutouts. And it's like, no, we aren't. And so then I show the background of it, like the causes, like why people develop this kind of thing, so that they can see that some of us just don't come out right, but we're fine. It's we don't have to be perfect.
But it sounds like you're also seeing this, there's this chicken and egg thing, because it could be structural and the fascia and the soft tissue adapts to that, or tries to correct for that, but it also could be postural and habitual, and then the bones remodel to that. Is that right?
Yes. That is true. Well, apparently bone is able to stretch by about 25% almost at any time, except as you get older, it becomes more brittle. That's why if I put my leg out on the road and let some truck run over it, there's a really good chance I won't break anything, although I might be pretty cranky about it. And that's just because,
It's
the
not to
bones can
test that
actually
theory,
squish.
by the way.
And so it can go both ways, because at a certain point, fascia and soft tissue develops, it thickens in any position you put it in. So if you're in a position for a long time and you don't realize that you should be trying to counteract that, it can become the problem.
Is that the Davies law that the soft
It
tissue,
is, it's David, right.
soft
Yeah.
tissue will model to however you hang out in it?
I had these Australian teachers, and some man came who had been, and I'm sorry, this is a bad story. He was in a cage. He was actually a prisoner in some island they picked him up off of, and he had been in a cage, and he was like really squatted. And so he could only walk in that position. So they had to do a lot of fascial release, and they eventually got him to where it could be upright again.
Oh,
But it was a horrible thing.
there's a
So
happy ending.
yeah,
Bad story, but
yeah.
it ends well. All right. Well, so in the course, are we going to learn some movements that maybe if we did become aware of our own spinal anomalies, we might be able to address them?
Yes, and I hope for your students too, because we're our eyes, just like this client that her husband wouldn't tell her. Well, you don't go up to someone and say you have scoliosis. Is that gently you just start to tell them these imbalances and just encourage them to go into to try to reach more into what they can, and it will start to change. But definitely you'll start to see it. And I give correctives through it and how you can affect it. And in the practical, I'm definitely going very specifically to tell you, very concrete tools about how you can, how you see it. I go through a lot on how you see it, show you some cases of where it doesn't have to be rocket science. You don't have to go and have a PhD to actually do this, unless you want to become egg-headed and do that. That is great. That's your prerogative. But the fact is, we can do very practical things very quickly with people, and I call them body skills. So I'm going to go through those, because just if there's nothing else you can do, just start somebody's awareness of what they can start working on, and then they can make changes. So little increments of change, add up to big changes. And that's why it's important that we all develop lifelong practices with whatever it is that we love or are passionate about. And I highly recommend yoga, and I highly recommend Pilates if that's your bed. But sometimes starting out with one or the other, just pick something and do it. I tell people, look, just pick something and do it.
Something.
Yeah. Yeah.
Well, that sounds amazing. I'll be looking forward to your course. And thank you for sharing so much information with us about the topic. It's a complicated topic.
It is. And, you don't have to go into it to the level that I have. And I am really happy that people have decided around the world, to look more at this. And actually, the international community is really keen on all this now. And there's so many adults that are miserable. I'm sorry to say it that way, but are miserable. And so the more that we can keep sharing this knowledge among each other, there's this term that I learned called equipoise. And so what it means is that there's an ethical obligation to share our information so that people can get the best kind of movement education, the best kind of treatment that's available, that we know of as best practice, because who doesn't want to do their best practice in their teaching?
Awesome. Thank you so much for talking to us, and we'll look forward to your class.
Yay.
And thanks everybody for listening. Bye-bye.
Bye.